I'm Phyllis Jackson. Welcome to Stay at Home Connect.
Newly published research from the CDC involving pregnant and non-pregnant women with COVID-19 finds that while infected pregnant women have less risk of death, they're 5 times more likely to need hospitalization. Additionally, pregnant women were more likely to be admitted to the intensive care unit and require a ventilator. Dr. Denise Jamison is the chair of the Department of Gynecology and Obstetrics at Emory University. She provided some perspective on the findings.
I think it's going to be really important for those of us who take care of pregnant women to counsel patients carefully about really the importance of avoiding infection. It's also going to affect our counseling in terms of recommendations for vaccine. I think this provides more compelling data supporting offering the vaccine to pregnant women, since pregnant women have largely been excluded from vaccine trials.
The findings reviewed data for more than 325,000 women between the ages of 15 and 44 who tested positive for coronavirus. 8,200 of those women were pregnant. Talk to any new mom, and she'll tell you it's the most remarkable 9 months of her life, perhaps life-changing. Kathleen Canty knows the feeling. She and her husband, Jimmy, have 2 children, 2.5-year-old Kian, and the newest addition, Colette. This bundle of joy has arrived under unique circumstances. Kathleen's life, pregnancy, and birth all forced to make adjustments due to COVID-19.
I was really cognizant of not trying to do too much, to be quite honest. And so my husband, who's, my rock, my best friend, my support system, was really great. And he went to the grocery store, so I didn't have to leave. We live in an apartment building, so that was a concern about, getting in the elevator with people and such, especially with a toddler. So having to teach him to wash his hands and sing the song and do all of that. So really the changes were just making sure that we were being smart.
Dr. Adrienne Zertucci is an obstetrician gynecologist at Piedmont Hospital. Kathleen is her patient.
We've developed some altered prenatal care schedules in order to try and minimize the exposure of our pregnant patients to healthcare facilities. So, for instance, we're trying to alter the timing of some of their visits so that we can combine maybe doing both an ultrasound and a lab test and a visit with a doctor all at once, rather than having them come on 3 separate occasions. And then we're also integrating telehealth. And just this morning, I had 3 visits with 3 separate pregnant women over an audiovisual interface.
Dr. Zertucci says there are certainly some appointments that cannot be replaced with telehealth, but extra precautions are being taken with women who come into the office. It's comforting news for this second-time mom, whose mother came down from Philadelphia in March and got stuck here in Atlanta when the news of the virus broke.
So she ended up staying with us for 3 months in our 3-bedroom apartment with a toddler and the newborn. So we all got very close, but it actually worked out really great because, it's my mom and I love her to death, and she is, my support system as well. So it worked out that she was able to stay here. And then I was really worried about her health too. So it kind of gave me the sense of, peace that she was here and I knew she was safe and I knew that we could kind of all hang out together and be smart together.
Mom departed and will return as nanny to Colette and Kian, so Kathleen can return to work remotely as we all continue living in this new COVID-19 reality. Atlanta City Council member Marci Collier Overstreet is making sure residents in District 11 are protected from coronavirus. She stopped by Southwest Atlanta fire stations 25 and 31 to drop off free disposable masks.
That's it for this edition of Stay at Home Connect. Have a wonderful evening.